Welcome back to TV5 News at 9. It's time now for Aging in Style with McLaren. Joining us this morning is Dr. Jay Jagannathan. Thank you so much for being with us.
Thanks for having me, Veronica.
So today we are talking about back pain. So tell us a little bit about the type of patients that you see and what you see them for.
So I'm a board-certified neurosurgeon. I've been in practice for about 10 years, about 7 years in the mid to northern Michigan region. I see patients with all types of pathology relating to spine conditions. That includes degenerative changes, what's called spinal stenosis or narrowing around the spine, tumors, cancer, trauma, and related conditions. Commonly what we see are areas such as back pain, leg pain, difficulty with walking, as well as conditions such as neck pain. And our general trend is to kind of go towards less invasive surgery to kind of minimize the postoperative discomfort and increase the healing time.
So this is a big problem that a lot of people struggle with, including myself. So what kind of treatment options are there available for these people?
There are a number of treatment options that are available. We always recommend starting with non-surgical treatments, things like pain management, epidural injections, which McLaren provides an excellent network for. When those don't work, oftentimes surgical treatment is oftentimes considered. And as I was mentioning, the trend now is to go towards less invasive surgery, and that uses a combination of image guidance, using advances in MRI technology and intraoperative imaging technology to pinpoint the location where the problem is, along with advances in surgical technology that enable us visualization so we can see what's going on with an extremely small incision. And the effect of that, the net effect, is to hopefully increase postoperative activity, to decrease the use of pain medications postoperatively, and hopefully to increase patient functionality, how quickly they're moving and recovering after surgery.
That is really great to hear. And you know, one major concern for patients is losing their range of motion. So what technology is hoping to fix that?
So the trend in spine surgery in general has been towards motion preservation, which means doing what we can to keep motion intact. This is probably most pronounced in the neck, where artificial discs have been approved now, probably for about 10 to 15 years. In the last 4 to 5 years, the FDA approved artificial discs for 1 and 2 level pathology. So, for example, a patient who came in with a herniated disc in their neck that maybe 25 years ago would have had a spinal fusion now could have what's called a disc replacement, where the artificial disc takes the place of the cage or the plate and screws. And the major advantage of that is that it keeps the neck motion intact. As I mentioned, the other advantage of some of the more minimally invasive techniques is that we can use smaller incisions to clean out the areas where there's pathology and not necessarily always have to fuse like maybe would have had to have been done with an open or larger, more aggressive approach. And those are all technologies that we offer locally at Baymed. And my group, myself and Dr. Kramer, who's another board-certified neurosurgeon, have been at Baymed for the past year or so, and we're happy to treat patients with these conditions.
And I feel like for a lot of people, hearing the word surgery can be kind of scary for them. So what would you tell someone who may be a little concerned, maybe they don't know if they should seek help yet?
So I think the first step is to always look at non-surgical options. I mean, there are rare conditions where surgery would be your first route. Usually those are life-threatening conditions such as cancer, severe trauma, cases where you've got difficulty with walking or where the motor function is in jeopardy. In most cases, we always recommend starting with a trial of what's called conservative treatment, which are non-surgical treatments such as physical therapy and pain management. And most of the time, those are things that are done locally. When those don't work, the goal of surgery is not really a cookie-cutter mode. It's tailored towards what the patient's preferences and needs are. And that's where I think things like minimally invasive surgery really come into play, because the options are not necessarily the same as they were 20 or 25 years ago, where you have to have a major spinal fusion with a 6-month recovery process. I mean, it can be something that in some cases can even be done outpatient. And as we talked about earlier, things like motion preservation and things like that are cutting-edge areas in spine surgery, and I think those are things we're happy to provide in the Mid-Michigan region.
It is great to hear that there are plenty of options out there available. Thank you so much for taking the time to speak with us this morning, Doctor.
Thank you for having me.
And if you at home would like any more information about this topic, you can head on over to the hot link section of WNEM.com.